And so guess what? This week I had Dr. Beth Custer, I had Courtney Fenner on talking all about pregnancy, just navigating pregnancy and infertility. And so I know that Beth and Courtney had both talked about, again, having delayed unexpectancies, they're healthy women and just had those surprises with how that looked for them. But I do want to say, in terms of infertility, looking up some more things on reproductive health for those of you out there. And again, if you're new to this show, Dr. Amanda, I have all kinds of topics, but really wanting to empower people to share their story. So you can like, share, and subscribe. Just telling you that now. But again, 6%, according to statistics, of married women aged 15 to 44 may have trouble with getting pregnant after 1 year of trying. However, there can be 12% of women 15 to 44 in the United States may have difficulty with a pregnancy. However, I do want to say, and again, this is a side note, but I am a woman of great faith and great belief. And for me personally, when I look at all the women of faith, even women in the Bible who just their womb, for whatever reason, they had issues with infertility. When you look at all the stories, I think there's hope, even in the hardest situations, because I believe that I serve a God that can do anything. And if you look, Sarah, who is like in her 90s, had her baby, Isaac, Sarah and Abraham. And you also had the story of Hannah, who God opened her womb. So there are miracles. And again, this is a painful situation. So some of you may not have that faith and you've been like, well, I've always had infertility. But I do want to say that there are complications, and I don't understand that, but I also know that is true. But I also want to say that there's always hope. So if you have a heart desire to have a baby, it's possible. And again, a lot of times there can be different causes. So even for men, there's different factors. Trauma, it could be things with hormones, a big one. Sometimes they're not sure. Again, there could be different things with our bodies, and even for men or women, our health. And so there are shifts though that have happened. I know a lot of women have looked at that, but I also do want to say, I know Beth had mentioned, geriatrics after age 35, but I want to say that age, honestly, yes, as you get older, there may be some things, but honestly, I believe that it will happen. It will happen. And hopefully as we continue to heal and as our bodies heal, our bodies can do incredible things. So again, I know Courtney and Beth both were able to get pregnant. They had babies. I know there's so many different stories of loss and miscarriage or disappointment, and I'm sure that's heartbreaking, and my heart breaks with you. I also want to bring hope, because if we have hope, we can keep moving forward. So again, I know it's a big issue. It's hard. We don't always talk about it, but also being able to talk about this as women and men and just in relationships and being able to navigate. And again, just looking at our health of our uterus and ovaries and fallopian tubes, and those are big things. And even our menstrual cycle, you're thinking about that and knowing that, again, like there could be our menstrual cycle every 24 to 32 days. And again, just looking at that and just, but also the stress of it. Like when we put pressure on, sometimes that can cause even more anxiety. And that's, again, understandable if you're wanting to get pregnant and you're waiting. So I'm sure that can be really difficult. But I'm just on here to say, I'm glad that people are sharing, because sometimes it can be difficult. There's, depending on all kinds of factors, where you want to have something and it's not happening right away, and having to wait and learning all of that. And sometimes there may be some people that were like, well, I didn't have my babies, and it's really hard. Or sometimes people adopt or they have fostered children. And again, we have some amazing stories come up of my friend Sarah, who had babies, but she also adopted, and how it's her daughter. And so again, I definitely believe, whether biological or anything else, it can be a woman has the desire, not everybody, but a lot of people have desire to have babies. And again, there can be a really difficult process, but I was so proud of both Beth and Courtney for sharing their story. And a lot of you in the audience, if you're sharing your story, I'm proud of you. You may be in it may seem hopeless, but I just want to say there's hope. I want to speak hope in life over you. I want to speak that you have people that can support you and continue to keep going even when it seems hard, because you're amazing. And again, I just always have to keep on hope. I don't know what else we can hold on to sometimes, right? Our biggest rope is hope. And so I hope that you continue in hope, that all of your deepest heart desires come forth. in the right time. So you're amazing and beautiful women. And if you are women who've gone through this and you have similar stories, I hope that you also were encouraged, and hopefully you can share for other women. And hopefully we can share more about this because it's an important topic. So again, I hopefully you'll tune in. I know Courtney will share her story tomorrow and talk about her pregnancy navigation. Some of you may have had some different types of pregnancy areas that you work through. So again, you're amazing, you're incredible women, and all of us are moms in some way because we impact other people. So be well, take care, and I'll see you tomorrow.